Hello everybody, it's Dr. Mohammed Tauquir Ahmad from the London Aesthetics and Regenerative Centre here at our centre in Harley Street. And today I wanted to talk a bit about Botox or botulinum toxin A, which is more commonly known as Botox, which is the brand names of it, and dermal fillers. A lot of people are confused between the two, what they do, where are they used. Now, to understand this, there are two different types of lines. We have static lines, which are there all the time, such as nasolabials, the hollows under here, the lines up here. And then we have dynamic lines, which are lines of movement, which are in the glabella or in the forehead or when we smile. And it, depending on the type of line that you want to treat, depends on the treatment that you are able to, the treatment you will suggest. Botulinum toxin has multiple varieties available in the market, Botox being one of them, Botox being one of them, Dysport being one of them, Azalure, Xeonamin. There are lots of different brands of botulinum toxin. The most popular one being called Botox, and people tend to refer to botulinum toxin as Botox treatment. It works by paralyzing the muscle that causes the line. So when the muscle is not moving, the line is not formed, so that's not moving, that line is not forming. It's quite simple. However, we have now managed to extend the usage of Botox to other areas. For example, because it paralyzes the muscle, it can also be used over here for those people that have a gummy smile. It relaxes the muscle, so when they're smiling, the gums are not shown. Because it paralyzes the muscle, it can also be used on the depressor anguli oris muscle here, which will then paralyze and cause a bit of straightening up here and help with the marionette here. We also have bunny lines in the nose where it can be used for as well. It can also paralyze the mentalis muscle here in the chin, which is, as we age, causes the chin to come up, and that relaxes it, causing the chin to come down and softens the crease here. Another use of Botox also is for those that have masseteric hypertrophy, that is enlargement of these muscles here. It will shrink the muscle back down, taking it into a normal size, and can also be used to tighten the muscles of the jawline to give a bit of firmness up here. So the uses of Botox have increased manifold on the face. In addition, Botox has been used to paralyze the muscle in the sweat glands to stop excessive sweating, and then there are other body uses of Botox which can be used. In the neck, Botox can be used to treat the platysma, these bands of muscle that you get in older people. It can be used to paralyze that, to soften that, the platysmal bands, and it can generally be used across the whole face, the neck here, in which it causes, where you've got a crinkly neck, it causes a bit of firming of the muscles in there. Another technique which is being used for Botox is called mesobotox, where small amounts of Botox are infused throughout the face to cause a bit of tightening of the whole face, paralyzing the muscles that cause relaxation and causing the generalized, a small tightening on the whole face. Botox on the face has also been used to treat the sweat glands for acne, and it paralyzes the muscles in the acne sweat glands and thereby reducing acne as well. Dermal fillers are something different. Now, dermal fillers are used to treat static lines. They are used to volumize where volume is required. For example, they are used to treat the nasolabial lines, and for doing that, we would replace the volume, the medial fat pad, which disappears as we age. So by doing some technical and very specific placement of filler, we can replace the medial fat pad, which when doing so will help lift this line, soften this, and lift the jowl area. It can also be used to enhance the cheeks. It can be used to fill in nasal deformities. It can be used for contouring where people have a lot of laxity or loose skin. It can be used to just fill in that laxity and give a tightness and definition up here. It can be used to extend the chin. There are a lot of areas where it can be used in the face. In addition, people will be aware that it can be used in the tear trough area and to fill the hollows in the temple. In the neck, it can be used sometimes on the necklines also. In addition to that, areas in the body where it's used is for breast enhancement, it's where it enhances the cleavage area, and it can also be used in the butt area to create the effect of the Brazilian butt lift. So both Botox and dermal fillers are used in their own right to do entirely different things. Speak to the doctor concerned about what your concerns are. A doctor will be able to advise you, look, for this particular line or this particular treatment, It's either use of Botox, or use of fillers, or it's a use of combination therapy. I hope this helps clarify the information. Should you have any more information, please message us, contact us via our YouTube channel, or DM us on Insta or Facebook, or on Twitter. We look forward to hearing from you. Thank you very much.